too. Alice and Don, don't I? Oh, yeah. I think you're right. Okay, I'm on page 4-36. No, that didn't get your attention. Okay. Well, I'm finished with Norview Lodge. Bill just doesn't want to go back to work. He's going to hang around until dark. I believe we're finished with Norview. I think we left it there. I know you were. We'll just start in a second here. People a chance to settle in. Yeah, we're going back to administration. Thanks, Kathy. Okay, Marlene, I think when you're ready, we're on the administration, if that's okay with you. Pages 4-36, 37, and 38. Marlene, any comments on this you wish to make? You okay with administration? Do you want to make any comments, or we're ready for questions?
We're ready for questions.
I know you've given us an overall. Okay, 4-38. Let's go. Councillor Oliver. Yes, sir.
Thank you, Mr. Mayor. Just a general question to Marlene, and I apologize if I'm showing my ignorance a bit, but the cut that council made yesterday to the public health budget, does that impact in any way some of these programs, or is it all within the health unit budget that we were examining yesterday?
Through the mayor to Councillor Oliver, this does not impact the public health, so that will be reductions that we'll make in the public health budget.
Thank you very much. That was my thought, Mr. Mayor, but I
Yes,
thought I better
just want to
double check
confirm
just
it, yeah.
in case.
It's a good question. Well, yeah, go ahead, Mr. Broughton.
Well, I'm clear here. So are we really dealing with a few employees that work both sides of the fence here? Is that how it works? Or why do we call it health if it's... I realize there's a lot of other things here. We've done Norview, et cetera, but are we dealing with anything health other than maybe a few supervisors? Is that how it works in this budget?
Through Mr. Mayor, it's the Health and Social Services Department. The fact that we deal with the Board of Health budget separately doesn't change the name of the department. So, I mean, essentially, you're looking at the divisions other than the Haldeman Norfolk Health Unit here. Is that fair enough to say?
Thank you.
Is it? Sorry, my back's to you, Marlene, but so the 5.6 people in Health and Social Services Administration are totally separate from the health budget.
Through the mayor to Councillor Brunton, that's correct.
Thank you.
Okay, thank you. And yeah, we certainly have the community services and administration budget, and public works, for example, has exactly the same format. Okay, so page 438. Any questions on that? Okay, I'm going to move on. Health and Social Services Administration Buildings and Central Services, 4-39 and 440. We'll turn to that and have a look. An increase here of $4,400 on this budget. Councillor Black.
Thank you, Mayor Luke. Just a question in regards to 439, prior year's achievements, roof replacement, security enhancements. So when we look at the rent per square foot of that facility, it looks fairly cheap, but it doesn't include this roof replacement, right? So if you were to add that roof replacement to the total cost of the square footage, it would go up.
Through the mayor to Councillor Black, actually in the lease, the main capital repairs, such as the roof and the parking, are actually the landlord's responsibility. So although the roof was completely replaced in 2016, that was at no cost to the county.
No cost to the county?
No.
Oh.
However, the enhancements that were done from a security perspective that were through some health and safety concerns that have been brought forward by staff, they were our responsibility, and we were able to fulfill those enhancements with the budget that we had allocated in 2016.
Okay, and what about the heating systems and the air conditioning units and all that? Is that all landlord responsibility, or is that?
Through the mayor to Councillor Black, it depends. Any major capital expenditures are outlined in the lease that are the landlord, so a lot of them are, but any maintenance to certain levels are the responsibility of the county.
Okay, thank you.
Thank you. Councillor Oliver.
Thank you again, Mr. Mayor. On page 4-39, Marlene, under the main budget drivers, I read that first bullet carefully about the postage costs, and you're saying within the Central Services Division summary, we've reduced by $52,000, but can we assume then that there were $52,000 in new charges assigned to various other departments because you can identify them at the meter? Is that the simple way of looking at this?
Through the mayor, that's correct. So we are able now to have true costs of the postage, so we've actually allocated them throughout the other divisions in the health and social services budgets.
So in other words, when we send out perhaps checks to our social service clients, that's being charged to social services now, not the overall division budget.
Through the mayor, that's correct.
All right. Thank you. So it's a wash in terms of the levy, essentially.
Correct.
Yep. Thank you.
Further? I'm going to keep moving forward. I am also willing to go back if I'm going to quickly. Next, we will go to our social services. Some highlights on 441, 442. The numbers are on 4344. And we see here a net levy requirement of a decrease of 9.3%. Mr. Brunton.
Well, I guess my question to you, Mayor Luke, to Marlene. Marlene, this dental program, what's your thoughts on that?
Through the mayor, I can start to answer, and then I would like Heidi to speak to it because her team has been instrumental in bringing that forward to the county and through the deputation yesterday. I think when we're looking at prevention and some of the emergency services that we're currently providing for our participants on OW, that this is a program that is important so that we can have the preventative care for this for our participants, so we can actually look at reducing some of our discretionary benefits when we're dealing with emergency. So, I mean, we heard the deputation yesterday, and there's clear benefits of having dental care on a preventative nature versus a reactive emergency nature. So, staff are strongly recommending that we incorporate this into our one of our services that we would deliver. And I'll ask Heidi if she wants to add any comments.
Thank you, Mr. Mayor. Through you to Councillor Brunton. The discretionary benefits budget for Ontario Works is a capped budget at $10 per case per month. And out of that discretionary benefits, we pay for things like funerals and vision care and emergency dental. We have done some analysis of our expenditures in the discretionary budget from last year, and we are fairly confident that we could begin to offer adult preventative dental care in our communities with less than the $63,000 that we are requesting. The $63,000 that is being requested as part of the new budget initiative is in essence a worst case scenario if we had full uptake up to the 75%, and if our discretionary benefits costs in other areas such as funerals and vision care, as I mentioned, were to continue to increase. So for a variety of physical health reasons, mental health reasons, employability reasons, we feel really strongly that we should be adding adult preventative dental care to our discretionary benefits budget, and we also feel quite confident that we can do that for less than what we're asking for, and we would use our capped budget first before we looked to use that 100% municipal contribution.
Okay, and if I may go on, Mayor Luke, the other one, sorry, I got the numbers mixed up there, but the early years child and family serve one-time grant of, am I reading this right, $87,000? Now, we seem to get a number of these, like we got a one-time grant in EMS for, I forget what it was, something to do with the hospital, but they throw the money at us, but then it disappears later on. So I guess my question to you, how about that $87,000? Is that as far as one-time funding? Do you think it's money well spent on that one?
Mr. Mayor, if I could answer that question as well,
Please.
through you to Councillor Brunton. The Wage Enhancement Program is a program that is mandated by the Ministry of Education that we as the CMSM need to deliver in Haldimand and Norfolk counties. And that is where the ministry provides us funding to provide to our licensed child care operators an extra $1 an hour for their registered early childhood educator staff. The purpose of that is to make sure that we are attracting the most qualified staff to work with children in our licensed child care centers. We don't have a choice at the CMSM level whether we deliver that program or not. It's a mandated program. Within that wage enhancement funding, they also provide us with administration funding in order to deliver that program. And so using that wage enhancement administration funding plus additional funding that we have available within our 100% provincially funded budget for children's services, we can add this FTE to our children's services complement to deliver the mandated program at no cost to the levy. If in the future, as with all of our positions within social services, if the Ministry of Education decided that they were not going to deliver the program anymore, or if we did not have the funding for it, then that position would cease to exist.
Thank you.
Thank you. Councillor Block.
Mayor Luke, just looking at 442 and main budget drivers, I'm interested in the third bullet, provincial grants net decrease. I know there's an exchange of services, I guess, an upload of Ontario Works back to the provincial government. Will there be a net overall savings? I know they would upload it and then reduce